This segment of Delmarva Life is brought to you by TidalHealth.
So you've heard it all before already. More than 1 in 3 adults in the United States is overweight. Obesity is an epidemic. But did you know this? Being overweight can actually lead to other chronic problems like diabetes, heart disease, even cancer.
Maybe you've heard it, and no matter how hard you try, you just can't take off those pounds. It's so frustrating. Perhaps it's time to look into medical weight loss. Okay, so what does that mean? Well, here to help us figure it all out is Dr. Sandra Pallavicino with TidalHealth Weight Loss Surgery in Seaford. Doctor, thank you so much for joining us this afternoon.
Thank you for your invitation.
Okay, so let's get right to it and answer that first question. What is medical weight loss?
All right, so in the last 10 to 15 years, we as medical doctors are being seen that, like you say, the epidemic of obesity, basically overwhelming in our practice here. Patients decided to take this more seriously, especially with all the science behind why do we gain weight, what is the reason we are increase our hunger, how does our fat cell grow, etc. So with all that science behind it, we have created whole programs and practices to help patients lose weight without surgery. So that will involve interventions like dieting or improving their food intake or what will make sense for them. Patients who have other eating disorders or food addictions, we also work with that. So anything that involves the treatment of obesity that does not include surgery, even though we do support patients who are going to have a bariatric surgery.
So what kind of things should a patient consider in trying to make up their mind between medical weight loss and bariatric surgery?
Well, that's a great question because nowadays they may not be separated. What I'm trying to say now, we are seeing obesity care as a continuum of care from the patients. So we want patients to come to our doors when they're concerned about their obesity, and then we'll guide them to what will be a best option for them. The absolute goal is to have them to lose weight in all possible ways. Remember, this is a chronic condition, and it could recur or come back. So that's when we have to have all the tools to help them.
It sounds to me like something of major importance here to you is education and the patient understanding their dietary needs.
Absolutely. I try to base my practice in tons of education. I always tell the patients, I want you guys to know everything I know. I want you to understand everything I understand. So, and if science changes, we will continue to educate them in the new changes. So for right now, when they're here with the appointment, we will continue to not only tailor the weight loss goals and the weight loss methods for each patient, but definitely give them a continuous education so they can understand what they're going to eat if they're at home or in a social situation or in a restaurant, what to get in the stores, what happened if I'm in vacations, what should I be continue to eat. So they have plenty of education to make those decisions on their own as we keep on going with their care.
Now, we mentioned it when we first start talking about it, there are different health problems that obesity can cause or make worse. How can weight loss keep you from getting those problems or maybe doing away with them altogether?
That's what makes my day, when I see those changes happening in the patients. When you help somebody lose weight, you're helping them not only with the conditions they're coming with, but also prevent conditions in the future. Obesity is associated with multiple metabolic complications such as diabetes, high cholesterol, but also mechanical complications like sleep apnea or arthritis or arthritic pain, but also even inflammatory complications like heart disease and 13 different types of cancer. So the patient who's presented to us sometimes come with some of these conditions ongoing already on treatment, but we're also trying to prevent the advancement or the new appearance of these complications when they lose weight. So this is what makes my day and what makes me feel like we're making a difference.
Wow. Dr. Sandra Pallavicino, thank you so much for talking to us this afternoon.
Not a problem, whenever you need.
Awesome. Thank you so much.